I'm Dr. Elise Berman, the Medical Director of Breast Imaging at Fairfax Radiology. I have been at Fairfax Radiology for 22 years. If we can see something under ultrasound, we would do an ultrasound guided or an ultrasound directed biopsy. If it's something we only see on the mammogram, we would do a stereotactic guided biopsy, and that's using the mammogram machine to guide us to the area for biopsy. Sometimes a person will have a finding that we can only see on a breast MRI, and then we would do the biopsy using MRI as guidance. So if you need a biopsy, one of our breast navigators will talk to you about the procedure, explain everything that's going to happen, and get you scheduled for the biopsy. When you come in for the biopsy, you'll meet the technologist and the radiologist who are going to be doing your biopsy, and the radiologist will go over everything in detail about what to expect for the biopsy. When we do an ultrasound biopsy, we start off by looking with ultrasound to find the area. We clean the skin and then give lots and lots of numbing medicine. You'll feel a little bit of pressure, and we do the biopsy. And the biopsy itself takes seconds. For a stereotactic biopsy, it's a little bit different. You'll lie on a table on your tummy, and there's a hole in the table. Your breast goes into that hole. We put your breast into a little bit of compression and take a picture to find the area. Once we find it, the whole procedure takes less than 10 minutes. We'll do the same thing. We'll clean your skin, give you lots of numbing medicine. You'll feel some pressure. We'll verify the position, give you a little bit of more numbing medicine, and then do the biopsy. Both times we put a biopsy marker in, so we know exactly where we did the biopsy when we look at the mammogram. So the biopsy is done by the breast radiologist. A breast radiologist is a doctor who has special training in radiology and then goes on to do additional subspecialized training in breast imaging. When you come in for a biopsy, I always recommend that you eat something beforehand and wear something that's comfortable. You can wear deodorant when you get a breast biopsy. I know a lot of people think that they shouldn't wear deodorant, but that's okay. You can drive to the biopsy and you can drive home. If you want to, you can absolutely go to work after the biopsy. We do ask that you don't do anything strenuous for the next 3 or 4 days, so that would be no heavy lifting, pushing or pulling. We do want you to wear a tight bra, even to sleep in, for the next 3 or 4 days. We will give you an ice pack that you should use for the next 24 hours. And if you want to or feel that you need it, you can take some Tylenol. When you have a biopsy, we will call you with the result. If it is something that does need surgical consultation, then we will let you know which breast surgeon your doctor would like you to see. We will give you the contact information, and we will be sure that that surgeon has all of the information that they need to take the next steps together with you. You can go to fairfaxradiology.com, where there's lots of information on procedures.